Okay, Mark. So for the next part of the assessment, we're going to do an abdominal exam as well as a peripheral vascular exam, just testing the blood flow to your extremities. But before we start this exam, before this, we did a full set of vital signs. Everything was within normal limits. Your temperature was at 98.2 degrees Fahrenheit. Your blood pressure on your right arm was 117 over 62. Your pulse was 65, and your respirations were 15, and they were regular. And your oxygen saturation was at 99%. On a scale of 0 to 10, can you rate any pain that you're having right now?
No, no pain. Maybe a 1. I don't know. I don't really have much pain.
Okay, but what, if you're saying a 1, where's the pain?
Probably like my wrist hurts a little bit, but it's not a big. It's not stopping my function throughout the day or anything.
Okay, sounds good. All right, so what I'm gonna have you do is I'm gonna have you lay flat here. I'm gonna lift your shirt up so I can just inspect your abdomen. So I'm just inspecting your abdomen. I'm looking for the symmetry of your abdomen. I'm also looking for any stretch marks, any masses that I can see visually. I'm going to look for any pulsations around your abdominal aorta. I'm also looking to see if there is any hernias that I can see, stretch marks, anything like that. And everything looks normal. I don't see anything visually in that regard. Also noting any peristalsis, which is like your bowel movements. I don't see anything like that, at least from the outside. What I'm going to have you do is just kind of raise your head up for me. And perfect, I'm just taking a look here just to see if there is any hernias, any masses, or any separation of the abdominal muscles, and I don't see any of that. Okay, so next what I'm going to do is I'm going to listen with my stethoscope to all 4 quadrants of your abdomen. I'm listening for vowel sounds. Usually they range anywhere from 5 to 30 sounds per minute, but for the purpose, I'm just going to go through each one and make sure that I hear something. I'm not going to listen for a full minute each time. Okay, everything sounded good. What I'm going to do next is I'm going to go ahead and listen for at your abdominal aorta for any bruits. I'm going to listen with the belt and the diaphragm of my stethoscope. Okay, and I don't hear any bruits on your abdominal aorta. I'm also, just like I said earlier, I was noting, I'm looking at your abdominal aorta and I don't see any pulsating or any bulging there as well. I'm also going to listen with the belt and the diaphragm for the other arteries. I'm going to start with your renal arteries, just above the umbilicus on both sides. All right, next we're going to go to your iliac arteries. And your femoral. Okay, and I didn't hear any bruits at any of the arteries that I listened for on your abdomen. So what we're going to do next is I'm going to percuss your abdomen. I'm going to percuss all 4 quadrants. I'm just listening for more of a tympanic sound because what that indicates is that there's mostly air. If I were to hear anything dull, that would mean like possibly a solid mass.
Okay.
Okay? Okay, yeah, everything sounded good. Tympanic sound. So what I'm going to do next is I'm going to percuss the borders of your liver. I'm just going to I'm going to start from the bottom and work my way up, and then I'm going to start from the top and work my way down. You can just relax your arms for me there. And I'm going to start percussing until I feel dullness on the bottom and dullness from the top, and then I'm going to measure how the borders of your liver, okay? There. Thanks. Okay, and then we'll just take over here. About 7 centimeters, which is normal. Anything from 6 to 12 centimeters is normal. What I'm going to do next is on the other side, I'm going to percuss for splenic dullness. So I'm just going to do the kind of the same thing from the bottom. And I'm going to see if I can feel for any dullness when I percuss. If I do feel any dullness, that could mean a possibility that your spleen is enlarged. We're hoping to just hear the tympanic sound. Yeah, all I hear is tympany. So that's a good sign. That means that your spleen is most likely not enlarged. So what we're gonna do next is I'm gonna do a light palpation. Just feeling for any masses. Are you having any pain when I push down?
No.
Tenderness anywhere?
No, it's okay.
Okay. No masses, no tenderness anywhere. I'm kind of looking at your face, making sure I'm not pushing down, and you're just telling me no, and no pain. Okay, very good. And before I do a deep palpation, I'm going to just test for any gastric air bubbles. So I'm going to start at the 5th intercostal space, and I'm going to move inward. And if I hear like a high tympanic sound, then that could possibly mean that there's a gastric air bubble present. Okay, so next I'm going to do a deep palpation. So it's going to be firmer than when I did a light palpation. I'm going to check if I'm looking down in the right side, just feeling more for your appendix, if you're having any tenderness there, and then also on the left side, if there could be, I mostly will probably feel like your colon and things like that, but if there's any masses, so I'm just going to do a deep palpation, and then I'm going to go up into your liver next. You doing okay?
Yeah.
I know it's kind of hard. Sorry.
It's alright.
Okay, so next I'm going to go ahead and I'm going to depalpate for your liver. What I'm going to have you do is take a deep breath in for me and out. I know it's hard. Sorry. Okay. And I'm going to do the same thing over here on this side for your spleen. Go ahead. And I don't feel anything. Usually when you're taking that deep breath in, it's helping your diaphragm push the spleen down. And if there was any enlargement, I would be able to feel that. So what I'm going to have you do is I'm going to have you sit up for me. And I'm just going to go ahead and you can sit forward. I'm just going to go ahead and percuss down your back on both sides, and you're going to let me know if you're having any pain. This is just testing the costovertebral angle, if you're having any kidney pain, okay?
Mm-hmm.
Anything?
No, it's fine.
Okay, anything over there?
No.
Okay, perfect. So that's good. Your costovertebral angle, you're not having any kidney pain.
No.
All right, next you can go ahead and lay back down. We're going to do an assessment on the peripheral vascular system. We're going to go ahead, I'm going to just take a quick look at you overall, both your arms and your legs. You can relax your arms. I'm noting the color. You're pink, you're warm, bilaterally everything is even, your skin is dry. Hold down. I'm gonna just check for capillary refill. Less than 2 seconds on your hands. I'm noticing your nails, there's no clubbing. Just check some capillary refill on your toes as well. Okay, and then also I'm not noticing any varicose veins. I'm not noticing any peripheral edema, no swelling anywhere. The hair is distributed evenly on your arms and especially on your legs and your toes. And I don't notice any muscle atrophy or anything like that. Next, I'm going to go ahead and I'm going to palpate your peripheral pulses. I'm going to start with your radial pulse. I'm going to check both sides. They're even in rate, rhythm, and amplitude. Do your brachial pulses. I'm going to do the popliteal. Can you just go ahead and bend your knees for me? Thank you. Posterior tibialis, as well as the dorsal pulse. And your pulses throughout were even, rate, rhythm, amplitude, everything like that. I did this in the previous exam, but with the abdominal arteries, but I'm going to go ahead and I'm also going to listen to your carotid artery for any bruits with the bell and the diaphragm. So I'm just going to have you turn. Okay, very good. And I don't hear any bruits in your carotid artery, and I didn't hear any, like I said before, in any of the arteries in your abdominal area. So what I'm going to do next is we're going to check for jugular pulsations. So since you're lying flat, I'm going to have you turn to the left, and I'm going to note where I can see the internal, or usually you can't really see the pulsation of the internal jugular vein, but I'm going to look for the jugular vein as well as the carotid artery. And the main difference that I'll be able to notice in the when the heart beats, I can see 2 pulsations with the vein and 1 pulsation with the artery, as well as the carotid artery is palpable and the vein is not. And yeah, I can see the difference between the 2 with the pulsations as well. So what I'm going to do is I'm going to check for jugular venous pressure next. So keep your head turned to the left for me as well. I'm going to just note where I see the highest area of pulsating in your vein. And I'm going to have you kind of sit up a little bit. Let me put this pillow behind your neck. Okay, you can go ahead and lay back down and turn your head to the left. Okay. Ruler. And what I'm going to do is I'm going to note the highest area that I see a pulsating, and then I'm going to move that out, and then from the substernal notch see where that is. It's about 1.5. Okay, perfect. All right, and that should be everything for this portion of the exam. Thank you so much.
Thank you.